Osborne, welcome back to another episode of the Pick Dr. Osborne's Brain Show. And tonight we've got a great topic. We're going to be talking about how gluten can affect breathing and airway passages and contribute to airway inflammation and asthma. And so it's going to be a great topic tonight. Before I get dialed in on this topic, make sure you are chiming in. Let me know where you're from. Let me know how you're doing tonight. So just hit the like or share button and let me know where you are in the world, and let me know where you're from. Let me know that I'm coming in loud and clear for you, so that we can move on with tonight's show. So hope those of you who have been paying attention for the last few weeks again have been dialing in for your New Year's. You know, a lot of you have made health resolutions for the new year, and I want to make sure that, that you're staying on track. So we're also going to take some time tonight after we talk about this topic, after we talk about basically can gluten cause or contribute to airway obstruction, airway inflammation, asthma, difficulty breathing. We're going to talk about all the different nuances and ways that can happen. I want you to make sure you're posting your questions so that if you've got any challenges, if you've got any blocks, or if you're stuck, we can help get you through that so you can continue to maintain those New Year's resolutions in a great and positive way. So go ahead and type those in now. Let's just see who we've got coming in. Looks like Anna from New Jersey is chiming in. Carla from Sugarland. Julie Young from Florida. All right, Julie, just started reading No Grain, No Pain. Those of you who haven't read it yet, Julie says, just started reading it. Impactful. Thank you, Julie, for tuning in. All right, looks like we've got Anita Hampton from Independence, Missouri, chiming in as well. Again, let me know where you're from and say hello. Don't be shy. Hello from the Woodlands. Kayla's chiming in. All right, so let's go ahead and get started. Let's talk a little bit about gluten and asthma. It's one of those things, a lot of people, a lot of the times, asthma is actually one of the big reasons I see in my office with my clients that people will come in, they'll have been to several other doctors, they'll have asthma-like symptoms, essence, it'll be hard for them to breathe. They've been told they have upper respiratory infections. They've been told they have things like bronchitis. They've been put on multiple antibiotics over and over and over again. And they've been put on bronchial inhalers and steroid inhalers and medications basically to treat an asthmatic-like condition. And the doctors haven't even begun to entertain their diet or even discuss any impactful components on how diet can contribute to an inflammatory reaction in the airways. A lot of times too, I'll see these people and not even just diet, but I mean, a lot of doctors say, oh, diet has nothing to do with your breathing, but they won't even test them for environmental allergies. So, a lot of times they'll just put them on an immune suppressing allergy drug, like an antihistamine or a leukotriene antagonist, again, or a steroid, which suppresses the immune system. And so instead of actually ascertaining what the immune system is overreacting to, and actually running a test that could validate that so that might help you as a person, they're just being put on a medication. So even many times asthma and reactive airway disorders or diseases can be caused by environmental allergens to things like molds and grasses and different types of pollens and things of that nature. And that can be helpful information. And one of the reasons why is that if you know that you're allergic to ragweed and you know in your area that every October ragweed is its highest, then you can go inside, you can run HEPA air filtration, you can save yourself part of the misery of being outside and impacting your immune system to such a great degree that you end up getting sick. So that information can be helpful. And sometimes, even though you may not be able to, to prevent hay fever or prevent ragweed or prevent cedar fever, if you live in an area where there's a lot of cedar trees, you certainly can take precaution in terms of when those things are going to come back or going to be highest in the air in the environment. So, okay, looks like we got many more of you chiming in. Wow. So Tracy from Milwaukee, Wisconsin, Bonnie from Washington State, Rel from Los Angeles. That's a unique name, really. Kim from California. We've got Linda from North Carolina. Dea from Sydney. I'm going to assume that's Sydney, Australia. And then Debbie from Denton, Texas. Amber from Canada, NB Canada. And what is NB? What does NB stand for? Let me know about that, Amber. I'd like to know where you're from in Canada. Tara from the Ozarks in Missouri, just diagnosed with asthma. Tracy from Alabama. All right, so more and more of you tuning in. So let's talk about some of the ways or some of the things you need to understand about diet and the impact, especially gluten and grain. And if you tuned in last week or the week before, we talked a lot about rice. We talked a lot about corn as being, major problems associated with inflammation in those who have gluten sensitivity issues. So let's talk about that problem. So the scenario is you go to the doctor gives you a diagnosis of bronchitis or even a diagnosis of asthma. And the first thing is either antibiotics or immune system suppressants. Those are the two go-tos. And you look at those New Brunswick, and Amber's from New Brunswick. That's what I thought it was. I just wanted to make sure. But anyway, you get put on these medicines that, again, the job is to suppress the immune system, block the immune system in some way, or an antibiotic, which is if there's the suspicion that the reactive airway or that the inflammatory airway is being caused by an infection. And oftentimes it's the 1-2 punch. It's both. The doctor gives both because they think that you might be at risk for infection. So they go ahead and prescribe an antibiotic kind of prophylactically, even though you may not have the infection. And a lot can happen with that. In essence, a lot of damage can happen with that 1-2 punch. And part of what happens is you end up, think about it like this, with an antihistamine. So these are drugs like Benadryl. They block your body's ability to produce histamine. And understand that you need histamine to make stomach acid. So part of the side effect of taking an antihistamine is it's actually going to suppress proper stomach acid production. So it's going to make you more susceptible to infection because when you block stomach acid and you're eating food and there's bacteria in that food and there's parasites in that food and there's mold or yeast in that food, just because those things are in food, your stomach acid's job is to help protect you from those things and destroy those things so they don't have the ability to get down into your lower GI tract and colonize. But you're taking this medicine to treat your allergy symptoms to improve your breathing that's suppressing your capacity to digest, but also suppressing your immune system within your stomach and its function at preventing infection. And so you end up with, again, an immune system that's less strong. Again, you're blocking histamine and that suppression of the immune system. It doesn't fix the problem. It may mitigate the symptoms of allergic response, but it will not fix the problem. So if you're reacting to your food and you're overproducing histamine because you're eating the wrong foods, that antihistamine isn't going to fix that, and changing your diet is the only thing that can fix that. But again, you're also going to suppress stomach acid. You're also going to contribute to malnourishment along with an increased risk for infection. And what kind of malnourishment are we talking about? I think that's important in this conversation because when you block stomach acid, you block protein absorption and calcium absorption and vitamin A and zinc and magnesium and copper and chromium, and a number of nutrients require acid to be properly absorbed. Iron is another one. So when you start blocking these nutrients or hindering these nutrients from properly being absorbed, you actually can suppress the immune system even further because many of these nutrients are required by your immune system to properly function. So not only, again, are you hindering the immune system, but you're hindering the digestion of nutrients that are required to make your immune system strong and work effectively. In essence, to work effectively around you in your environment so that you're not having quite the allergic types of responses. And if you're taking something that's not an antihistamine, let's say you're taking one of the leukotriene-based drugs, the same thing happens. And if you're taking a steroid, look, with steroids, you're blocking calcium and magnesium and zinc. You're creating and contributing to bone loss. You're suppressing the immune system, and you're increasing the risk for the development of several different types of autoimmune disease. So that's no better. I mean, that's really no better. It's not a long-term solution. But often, again, this is the scenario that I see. Too many people coming into my office, and this is the scenario that they've been forced into. This is what their doctors have done for them. And so, you multiply that by a year and 2 years and 5 years, immune suppression for 5 years combined with nutritional deficiency influence for 5 years, and you've got a big mess. And so how do you make a comeback from that? Well, step one, very simply put, step one is you've got to identify whether or not you have food triggers. So identify those food triggers, because oftentimes the asthma trigger itself is food, not something from the environment that you're breathing in, but oftentimes it's food. And what probably one of the most notorious that I've seen, and the research backs this up, is that gluten sensitivity. Gluten is actually can be a major contributing cause to asthma symptoms and to airway inflammation. So those of you who are maybe on the fence, you're not quite sure if there's a link, you're not quite sure whether or not going on a gluten-free diet is going to even help you at all. Keep in mind that asthma was once called, there was actually a specialized type of asthma, and it was known as baker's asthma. Now, baker's asthma, because when back in the day, the bakers would be actually baking, and it'd be flipping the flour, and it would be going into the air. So you'd have aerosolized wheat flour, and they'd be breathing it in, and they would develop asthma as a result of breathing in through their lungs, the flour dust. And so baker's asthma was a very, very real issue. Now, that's not the same thing as gluten sensitivity. Baker's asthma is actually an immune reaction to wheat flour. It's more IgE mediated, so it can create, again, the symptoms of asthma because you're breathing it in. But I see this not uncommonly in many patients who work in places where pizza is being made, where they're hand tossing the crust, or work in places where a lot of flour is being used and dumped into big canisters. Is part of what they do at a number of different restaurants. Is they have these big industrial machines, and they'll dump flour in to produce a particular type of bread or a particular type of crust. And so that will aerosolize up, and you'll have a person start to react to that as well. So again, keep in mind that baker's asthma is one of the earliest kind of known reasons or known things that we know could trigger asthma. So, can grain contribute to asthma? Absolutely it can. From a baker's asthma perspective, we can get that IgE immune response, but we can also get asthma directly as a result of gluten sensitivity. And again, there are a number of research studies that have shown. I'm going to publish or post one of those up here for you on asthma and gluten. I'll put that in the feed for you. So again, if you want to go read more about it and get more information about it, you'll have that information. So again, we've got to identify the food triggers, and gluten is a major food trigger. So identifying gluten sensitivity becomes important. If you've been diagnosed with asthma and you have a diagnosis and they just say, oh, you just have asthma, and they didn't tell you why. In essence, they just said your son or your daughter or you have asthma. We don't really know why, but here's these antihistamines, and here's these bronchodillators that will help you breathe appropriately, and here's some steroids, and here's an emergency inhaler in case you get into trouble, and this is just something you're going to have to do for the rest of your life. That's not really an answer, right? That's just hey, here's this fatalistic diagnosis that the drugs are going to be necessary forever, and it doesn't really provide a solution as to why the inflammation is occurring, and that's really what we're after, right? So understand that asthma can be caused as a result of gluten exposure. And many people with gluten sensitivity don't have celiac disease. They don't get the GI symptoms. They get the airway symptoms. They get shortness of breath and trouble breathing. And that's what comes along with it and creates the problem. So now let's talk about other food triggers, because there are a lot of different food triggers, and there are a lot of different ways that food triggers can create a problem. So one of the problems with asthma is it's an inflammation. It's an acute inflammation in the lung tissue, and it's generally mediated by something called IgE. So IgE, and I'm going to make a note here, because this is something that you want to be really persistent on. You want to ask your doctor to give you an IgE test for food, not just for inhalants, not just for things like pollen and mold and dust. You want to have them test you for food, because food can trigger asthma as easy as something that you breathe in. And again, this is a test that can be very, very easily performed. It's best done if it's done as a blood test. Some allergists will do a skin prick or a patch test, which measures IgE response. But when you're doing it through the skin, there's a level of accuracy that's lost. In essence, it's a more accurate test if you can get it done through the blood. And so this type of test, it's very simply put, it's an IgE test for food reactions. And so ask your doctor and go in and just ask your doctor, insist that they run this type of test so that you can try to help determine whether or not you have a food-based trigger. Now, this isn't the only type of test for food-based triggers. You have what are called delayed response allergies as well. And so just a note on delayed response allergies, this is a different kind of test. It's not the same test as an IgE test. But with a delayed response allergy, understand that you can, if you're eating something consistently enough on a day in, day out basis, you can have a delayed response allergy that just creates low-grade inflammation in your lung tissue that sets you up for asthma. It doesn't have to be an acute flare where you eat something and all of a sudden you have a hard time breathing. It can be a delayed response as well. So this is the other thing that you really want your doctor to go in and measure these delayed responses and make sure that you don't have something that's delayed. A delayed response can take up to 3 weeks to really start to manifest. And that's why they're really, really hard. If you're keeping a food diary, or if you're writing things down and trying to figure out, okay, when I ate this, I felt this way. When I ate this, I felt that way. That doesn't always work with a delayed response allergy, because again, the reactions can be subtle and the reactions can take up to 3 weeks to start manifesting. So if you're trying to keep tabs on what it is, it can get very, very difficult and challenging. So again, asking your doctor to run a delayed response allergy test, not just an IgE, but a delayed response allergy test as well. Both of those things are going to be quite helpful, and to foods as well as to airborne things. So it's not, again, like I said at the beginning of tonight's show, knowing what you're allergic to within the air and the environment can be helpful, because it can allow you to establish what kind of air filtration that you can set up, when to avoid going outdoors versus when to stay inside. Because if you're allergic to mold spores, you certainly want to avoid heavy mold days. If you're allergic to ragweed, you want to avoid being outside on high level ragweed days. Those are things where you can make more intelligent decisions about how to protect and preserve your immune function and prevent an asthmatic type of attack or an inflammation in your airway. Okay, let's see here. Lots and lots of you starting to chime in. So we got Donna in Katy, Texas chiming in, Amber clarifying New Brunswick, Edna from Nova Scotia, Canada, another Canadian. It's a Canadian kind of night. We got Debbie from Buffalo, New York, Susan from Wenatchee, Washington. Oh, I like this comment here. Debbie from Buffalo saying, I was diagnosed with asthma. I've hardly used meds since I cut out gluten. I never put this together. Thank you. Well, you're welcome, Debbie. Thanks for sharing your experience with the audience tonight. It's a very, very common thing to see people who are maybe diagnosed with celiac disease, and they go gluten-free and their asthma symptoms clear up and they just don't make the connection. That's not an uncommon thing at all, though. Edna's chiming in. I've had asthma all my life. I read your book and started the grain-free diet in February 2017. I've been on steroid meds for a long time. Since I've been on the grain-free diet, I've been able to stop all my asthma medications. That's fantastic, Edna. Thank you for sharing, being brave enough to, first of all, to follow my diet. Many people aren't brave enough to do it. And thank you for sharing your story, because I know there are people listening tonight that are going to find that helpful, and maybe it'll encourage them to go pick up their own copy of No Grain, No Pain and really embark on their own adventure of getting better and clearing out their asthma. Don't hope, and well, you can hope, Kim, on a medication or a shot to block gluten from damaging the body. I wouldn't put all your faith or trust in that, because the best way to block gluten from damaging your body is to not put it in. And all these research studies that are going on right now about creating or trying to develop a vaccination and trying to develop different enzymes and different types of things that you can take that will allow you to go and eat pizza. Look, to me, I'm all for the advancement of science. I'm just not for the advancement of science when it's something so silly as a diet change. And many of you will say, well, how dare he? He doesn't know. Gluten-free diet is so challenging and cross-contamination is such a big issue. Yeah, it is. You're right. I know, because I follow it. So from that perspective, it's a diet change. It's simple. When you compare asthma as a quality of life, and a poor quality of life at that, to a diet change, I'll take the diet change any day. That beats having to suck in a steroid and destroy my bones over the next 20 years. When you take crushing villus atrophy in my guts causing malabsorption over a diet change, I'm going to take the diet change. That's the easy way out. So again, I'm not trying to pick on anybody here. I just, it's a diet change. I mean, and it seems hard at first, but it really, when you look at it in the long term, it's not all that hard. It just there's a learning curve with it, and it just requires a little bit of dedication, a little bit of learning, and moving forward in the right way. Tinka is chiming in, trying gluten-free because my triglycerides have been 2,600. Yes, that is correct, 2,600. Yeah, that's pretty high. One of the side effects, and I think we talked about this a few months ago, was gluten-induced liver damage or non-alcoholic fatty liver disease or autoimmune hepatitis. Those different conditions of the liver can really, really elevate triglycerides. And one of the things that creates that liver damage, or can, is gluten. So thanks for timing in, and let us know, Tinka, how that turns out for you. I'm really curious and hope it turns out really, really well for you. Here we go. My gluten side effects, Paul, my gluten side effects are completely in my sinuses, and it makes me have flu-like symptoms. It's another one. So think of it like this. So this is different. I'm glad you chimed in, Paul. Thank you. And I've seen this happen in a number of people, is that they eat gluten, the sinuses get congested because the turbinates in the nose will swell shut. And that's an inflammatory process that occurs in the nose. Now that will obstruct breathing as well. You'll have to mouth breathe. And when you mouth breathe, of course, you remove your nose as a filter from the air. So now you're breathing without a filter. You're drying out your mucous membranes in your mouth, and you're exposing the mucous membranes in your mouth to more potential pathogens because you're not using your nose as a filter. So that's another side effect of gluten, is that it can cause airway in your nose. It can cause that. I've actually had a number of patients that were, on the verge of a surgery. They were looking at, they were told they had polyps, or they were told they had narrow airway. And so they were going to go in and roto-root the nose, and they changed their diet, and lo and behold, the swelling goes away and everything kind of opens up and you can breathe again. And the surgery oftentimes can become unnecessary. So if that's something that you've been told, or something that you've been faced with, let's keep that in mind. If you haven't done the diet, do the diet first. You can always go back and have the surgery, but you can't reverse it once it's been done. Let's see here. Janice, I had celiac 2 years before official blood work diagnosis, and I never had any breathing problems whatsoever. Not saying it doesn't affect others like that, just didn't to me. So there's another one. It's like I was saying earlier, for some people, gluten affects and causes celiac. For others, it can create airway destruction and inflammation. So not everybody's reaction to gluten is going to be identical. And that's just another example of that. So, okay, so I'm gonna stop answering questions for a minute, because I really wanted to get I wanted to get into a couple of other points. So you've got immune suppressing medications that are chronically being used, and antibiotics that are chronically being used to address upper respiratory inflammation and infection. Whereas if we would just, in many cases, if we could just change the diet, we wouldn't require the medicines, and that could potentially save somebody from years of grief and years of drug-induced side effects. Now, one of the side effects that I really wanted to talk about tonight, as it directly affects your breathing and your capacity to get oxygen, and it can actually mimic the way asthma feels for some people, and that's anemia. So one of the side effects of gluten exposure, long-term gluten exposure for many people, is nutritional deficit from malabsorption, or nutritional deficit from chronic inflammation, meaning when your body's inflamed, it will burn through more nutrients to try to control that inflammation. And so you'll become devoid or nutritionally deficit in certain nutrients. And some of these nutrients, in particular, iron, vitamin B12, folate, vitamin B6, copper, can all those nutritional deficiencies, very, very common causes of different types of anemia. And so if you've got anemia, understand what anemia is. It's when your red blood cells don't properly carry oxygen effectively, meaning they lose the capacity to carry oxygen. And it can be caused either as you not making enough red blood cells. It can be caused as a result of you not making enough of the hemoglobin, which is the protein inside your red blood cells that carries oxygen. It can be caused as a result of your blood cells being misshaped or malformed. If you've heard of sickle cell anemia, that's a classic example of a malformed type of red blood cell that is more prone to not carrying oxygen as efficiently. But bottom line is anemia, and if it's a nutritional deficiency, anemia leads to a reduction in oxygen delivery. So there's plenty of oxygen in the air. You're breathing in plenty of oxygen. Your airways may not be inflamed at all. You're getting the oxygen to the lung. It's just that the red blood cells can't pick up the oxygen and carry that oxygen through the bloodstream and deliver it to tissues effectively. So you feel short of breath. You feel like you're out of air. And so this is, again, it can mimic the symptoms of asthma. I've actually had people come to see me. They were diagnosed with asthma. They really didn't have airway inflammation. They had severe chronic anemias that just weren't being identified or addressed. And so that's another thing that you might want to consider. So asking your doctor to measure, there are a couple of different things that should be measured that are simple to measure. But one of the ways to detect anemia is to run a simple CBC, a complete blood count is what that stands for. I'll type that in for you. A complete blood count with a differential, and what that's going to help tell your doctor is going to tell your doctor how many red blood cells you're making, whether you're not making enough or whether you're making too few. It's going to tell you about the size and the shape and the color of your red blood cells, because sometimes that's indicative of different kinds of anemia. It's going to tell you about your hemoglobin and your hematocrit, which is the hemoglobin. Again, it's the iron containing protein that carries oxygen. And if your hemoglobin levels are low, you're not going to carry oxygen very well. If your hematocrit levels are low, you're not going to carry oxygen very well. If your mean corpuscular volume is low, you're not going to carry oxygen very well. So again, there are these different tests. The complete blood count looks at a lot of those different things, and what you can also ask for, and what I would recommend that you ask for, because a lot of doctors will do a complete blood count, but they'll fail to look at iron. So ask your doctor for an iron panel, and ask them to measure ferritin as well. So an iron panel with ferritin, and that will help look at your iron levels a little bit more comprehensively. And then there's another test that measures copper in the bloodstream, because copper deficiency can also cause anemia, and that test is called ceruloplasmin. You can actually have that test done. You can also have whole blood copper levels checked, and you can also have lymphocyte proliferation copper levels checked. So you can have intracellular levels of copper checked. And then also have them check your B12 and your B6 and your zinc, because and your folate, because those nutrient deficiencies can also contribute to an anemia that mimics asthma symptoms. And you don't want to get a misdiagnosis. You don't want to end up, thinking you have one thing and then you're taking a bunch of steroids for years and years because you've been told you had asthma, and in reality you have anemia. So, just something to consider in all of this if you've been told you've got anemia. So again, something simple to look at, something that can be looked at on a simple blood test. Even your insurance will cover something like that. So ask your doc if they'll run that and give you a good differentiation between the two. Sandra's chiming in. She's got thalassemia, which is a whole different ballgame. Thalassemia is a genetic disorder. Predominantly, it's a type of anemia, so it's going to create an anemia on a regular basis. There are some things you can do to improve your blood viscosity if you do have thalassemia, and that would be making sure you have plenty of omega-3 fatty acids to keep your blood thin, making sure you have plenty of magnesium to keep your blood thin, so that the red blood cells are flowing very, very well and delivering oxygen to the best of their capacity, even in the case of thalassemia. Dea is asking, could we mistake breathing difficulties with heart problems too? Yeah, you could. If the heart is not firing properly, if there's an arrhythmia or something along those lines, that can oftentimes be mistaken as breathing difficulties. I mean, one of the symptoms of a heart attack is shortness of breath, right? And that's that pressure on the chest, and that has to do with lack of oxygen getting to the heart. And again, what is a lack of oxygen, right? Asthma is a lack of oxygen because the airways are inflamed. Anemia is a lack of oxygen because the red blood cells don't have the capacity to deliver it. A heart attack is a lack of oxygen to the heart because you've got artery narrowing or spasms in the coronary arteries that are restricting blood flow, right? So however the lack of oxygen occurs, all the symptoms can kind of have some degree of overlap. So you're absolutely right in that thought process. And I hope I say your name right, Dea, or I guess that's how you say it. Forgive me if I mispronounce it. Linda's asking, can gluten sensitivities open the door to autoimmune syndromes like Sjogren's? Absolutely, Linda. Remember that gluten is one of the main scientifically known forms of autoimmune disease, period. So like what we know about autoimmune disease is that gluten is a big trigger for multiple different forms of autoimmune disease, and Sjogren's is on that list. So to answer your question, yes. And I've seen cases where people with, Sjogren's, for those of you that don't know, it's an autoimmune disease of the ducts. So we get the lacrimal glands and the parotid and submandibular glands. There's an autoimmune attack to them. So the mouth will dry up, the tears will dry up, the eyes will be very dry. And that can lead, that can lead to a host of different kinds of problems. So, if you have that type of condition and you haven't gone gluten-free, you might just give it a try. And if everything cleans up and you feel better and you're not quite as dry, then you have an answer directly with how your body's reacting. All right. So, here's the direct question. How does gluten affect asthma and the bronchial airways? Well, the way it affects the bronchial airways is it actually can create inflammation in the airways. It can also create an excessive mucus production, and that excessive mucus production in the airways will basically occupy space, making less room for oxygen and airflow to come into the lungs. So there are different mechanisms as to how it can happen. But in my experience, for most people, it's an inflammatory response. It's really what asthma technically is. It's an inflammatory disease. So if you're eating a food that creates a systemic immune inflammation, remember, a big chunk of your immune system is in your lungs. It's there to protect you from what you breathe in, because we breathe in pathogens on a daily basis, and we have a strong immune system in our lungs to defend us from those pathogens. And so that's where that inflammation can occur. If we're breathing in those pathogens and our immune system is just busy with the day-to-day maintenance of breathing, right? But then we overwhelm our immune system with foods that we're reactive to, gluten being a potential possibility there, then what's going to end up happening is we're low on resources, and that inflammation is no longer going to be controlled as effectively, and it can get out of control. Let's see here. Nancy, one different positive I have noticed since following the no grain, no pain lifestyle. For the first time ever, my skin is accepting sunshine. Oh, I love to hear that. My dermatologist told me I was allergic to the sun and told me that was why I broke out in blood blisters with more than 5 minutes of sun. Let's see here. My skin now accepts it. Let's talk about why. There's actually some really neat studies on sunshine. One of the reasons people react to sunshine when their diet isn't dialed in is because, understand what sun is. Sunlight exposure, you're getting exposure to radiation, right? The rays of the sun, the light beams, the rays themselves is radiation we're getting exposed to. And radiation has a benefit, but it can also have a detriment. Obviously, too much radiation and burning can be a bad thing and contribute to cancer. But I'm not talking about getting sunshine and long enough to burn. I'm talking about daily sunshine. We all have a need for daily sunshine because the sun helps us make melatonin. It helps us make vitamin D. It helps us make other immune factors. And if we're avoiding the sun, we're missing out on those essential and crucial functions. But if your diet is highly inflammatory, if you're eating a diet that's highly inflammatory, you will be more prone to blistering. You will be more prone to burning. And this has actually been shown. It's been shown especially well. I was actually at the Space Congress. This was in Houston at the George R. Brown Convention Center, and it was the Space Congress annual convention. And they were talking about the research that was being done on the space station. And one of the studies that was being done was done on the laboratory mice. And what they were doing is taking mice and feeding one group sugar and feeding another group highly charged blueberries and strawberries with rich antioxidants. And then they were exposing them to solar radiation to see what would happen. I know it's cruel, when you think about the poor animal, but what the study showed is that the mice that were given the blueberries didn't have the radiative damage and develop the cancers, and the mice that were being fed sugar did. So a direct response, direct evidence, at least in laboratory animals, that what you eat impacts the way your body can handle the radiative damage that the sun might provide to it. So very, very common. This is why in the summer times you'll see if you subscribe to my email newsletter, and if you don't, you may want to go subscribe to it over at glutenfreesociety.org. Just type in your name and email, and you'll get our gluten-free survival kit, and you'll get our email newsletter. And one of the things I talk about, pre-summer, is I talk about how to load up on antioxidants to saturate your skin with antioxidant power to kind of protect you during the summer months when you're getting more exposed to sunshine. All right. Okay, Panina's chiming in. I quit gluten several years ago and all the inflammation disappeared. I find dairy causes asthma for me, and I'm sure gluten as well. So yeah, I mean, dairy can be another trigger. And actually, we did a show a couple of weeks ago all about dairy, gluten versus dairy, and the similarities and the different things that you should be aware of. So if you're gluten-free, but you're not dairy-free, you might want to go back and look at the archive on that. And so those of you who don't know where to find those archives, you can go over to my YouTube channel at youtube.com/glutenology and make sure you subscribe to the channel. But that's where we archive all of our shows, so that you can watch those. And if you weren't able to make the Monday Night Lives. So we got Midge from Philly and Marita from Brenham. Let's see here. So Marla's asking, how can we increase our red blood cells? Well, the bigger question is not how you can increase them. I mean, the bigger question is, are they anemic? Are they low? So if they're low, yes, you can increase them. You have to take in blood elements. You have to take in blood building elements. Some of the blood building, red blood cell building elements have to do with B vitamins. Iron, copper is important for this process. Magnesium is important for this process. Essential fatty acids are important to this process. So building new red blood cells is very, very important, especially if you've got a red blood cell anemia. So for some people, the red blood cell anemia, let's think about where it could come from. It can come from a lot of different areas. You may have an overall red blood cell count anemia as a result of liver not functioning properly. The liver helps to recycle red blood cells. It helps to break them down and recycle them. For some people, anemias, especially in females, can be caused during the menstrual cycle. If you have a heavy menstrual cycle, a super heavy period, can lead to aggressive blood loss that can land you in a state of iron deficiency, creating a red blood cell deficiency, and that can take a week or 2 or 3 to recover from. So that it depends on the individual and why the red counts might be low. Let's see here. Also low. Oh, that's not a question. So. We got Raj from Mission, Texas. Welcome, Raj. Diane from Pennsylvania. Okay, so Marie is asking, does giving blood increase your blood? No, giving blood decreases your blood. Now, if you give blood, it will take a time, but your body will repair and rebuild and remake blood. So if you go and give blood or donate blood, your body's going to rebuild that. But it doesn't increase your blood overall. Now, what some athletes do is they take their blood out and they store it, and then they add their blood back in before the competition. That's actually called blood doping. And what they're doing is they're trying to increase their blood volume. They're trying to increase their red blood cell capacity because that allows them to carry more oxygen. So, but no, giving blood does not necessarily increase your blood directly. It decreases your blood immediately, but then your body should respond if it has what it needs to reproduce and make more blood. All right. So Karen chiming in, yes, a resounding yes. When our family removed gluten, severe asthma symptoms were gone for my 3 sons and I. Autism and ADHD symptoms in my sons were as reduced. Taking gluten out of our diet, my husband has severe heartburn, which is also completely gone too after removing gluten. Has been such a game changer for our family. I run a local nonprofit, Individuals with Autism, and I always recommend taking gluten out of the diet as well as any other problematic foods. Well, Karen, thank you so much for sharing that. That's an amazing story. I'm so glad that your family found that going gluten-free was such a beneficial improvement to everyone's health. Julene Matthews, I absolutely have had a problem like asthma with gluten. Such an overproduction of mucus. I feel like I'm smothering. Yeah, it's one of the. I talked about this earlier. Aggressive mucus production. You make more mucus. Remember why we make mucus? Mucus is actually we produce mucus, and inside that mucus, we have an antibody called secretory IgA. It's called secretory IgA because it's secreted in our mucus secretions. So anytime our immune system perceives a threat, it's going to respond in those areas where mucus is produced by making more mucus. And so if we've got an infection, for example, here, we'll make more mucus, we'll make more phlegm. And that's why people, when they get a bronchial infection, they'll cough up a lot of mucus because they're making more mucus, because inside the mucus is antibodies to help defend them from the infection. This is why I don't like drugs that suppress coughing. You take the cough suppressing medications, and the extra mucus that you're producing, you need to cough because you want to get it up and out of you, because inside that mucus that's coming out of you, those antibodies have bound, they've grabbed onto some of those pathogens and they're coming out too. So it's not a great idea to take a cough suppressant. I mean, unless you're breaking ribs over coughing, which is, unless you're severely osteoporotic, that's a pretty type of rare situation. Don't suppress the cough. Let the cough come, because when the mucus comes out too, everybody wins. More importantly, you win. Donna's asking about anemia and iron, because we were talking about that a minute ago. What's a good ferritin level? Depends. So if you're a menstruating female, I like to see ferritin at least above 50. If you're just let me rephrase that. If you're a female, I like to see your ferritin above 70 if you're menstruating. I like to see it at 50 or higher if you're not menstruating. And if you're a man, I like to see it at 50 as well, 50 or higher. Men obviously don't menstruate. So ferritin is iron storage. For those of you who don't know, it's a measure or marker for iron storage. And if it's too high, then that can be an indicator for liver damage. Let's see here. I know that you don't want it too high. Let me read this. Let me read this in bigger letters here. But my regular doctor keeps saying that I should be glad that my ferritin is near the bottom of the range in the low 20s, and doesn't think I should get it above 50, especially as it relates to hair loss. I don't fully agree with that. I don't know that you necessarily need to go on a mission to get it above 50. I would say that, first and foremost is the person, how the person's feeling, what are the symptoms, and what are the experiences the person is having. Because I've seen people with ferritin levels that I would call low, but because they have absolutely no sign or symptom of anemia, it's not something that I necessarily want to pursue with heavy or aggressive iron. I might have, in those types of situations, I might have somebody eat liver or eat other iron containing foods or iron rich foods. Liver's probably one of the best if you can stomach it, if you enjoy it or like it. But if you're asymptomatic, it's not necessarily something you need to be bent on absolutely getting above those levels. Okay. Misty from the scleroderma group is chiming in. Welcome tonight, Misty. Thanks for chiming in again. I like this. Neuron, no grain, no mucus for me. So maybe we should retitle the book, No Grain, No Mucus, right? No grain, no pain, but definitely reduction in mucus. We don't want no mucus. Mia, how do steroid inhalers for asthma affect your health? What does one do once you're taking them and care during the flu and cold season? So, understand that steroid inhalers actually increase your risk for developing a cold or a flu, not the other way around. I know that may not be what many of you have been told or heard. Steroids are immune suppressants. It's part of what they do. They block inflammation. Remember, we use inflammation. The immune system uses inflammation to help us. So inflammation, not all inflammation is bad. Now, aggressive inflammation is bad if it's an overproduction of inflammation. But again, the bigger question comes from, where's the inflammation coming from? So if you're on steroid inhalers, look, talk with your doctor about where the asthma is coming from. I mentioned some blood tests that you could have run earlier, the IgE and the delayed hypersensitivity for foods. And let's see if you can clean up your diet or find some food-based triggers for asthma. And that way you may find yourself not relying on the steroid inhaler. It's something that I see quite frequently. People, once they start figuring out the food triggers, the steroid inhalers become less and less necessary. And over time, person just weans them off, and they have an emergency inhaler in case they ever did need it. But even in those cases, when somebody's diet is super clean, you just don't tend to see the need for it unless you have an acute allergen. in the environment that you're being exposed to. I mean, some people are truly allergic to some of the environmental pollens and other things, and so that's where their symptoms can flare. So, but if it's a food trigger, you've got to get that food trigger out, and that's how you deal with it. You deal with it by ascertaining what the food trigger is. As far as taking care of somebody during cold and flu season, Mila, go and grab my cold and flu season protocol. You can pick that up. It's on. If you type in cold and flu season protocol, Dr. Osborne, you'll be able to find it online. But it's a protocol and certain nutrients that are designed to strengthen the immune system to support you from getting the cold or a flu, and also to support you if you do get a cold or a flu to beat it back faster. So, okay. Jenna Johnson, anytime I eat wheat, I get tightness in my chest, pain and inflammation if I eat too much throughout the month. I eventually become so sick I'm bedridden. These are all new symptoms in just the last few months for me, but used to be able to eat it. I don't know what's changed. Well, your body's hit a tolerance, and this is not uncommon at all. Jenna, people oftentimes will hit, they'll be eating gluten their whole life, and they'll think, oh, I'm fine, I don't have gluten sensitivity. What happens is that gluten is not an acute poison. You don't eat, for most people, you don't eat gluten and then you're in bed dying. It's a cumulative damage. You eat a little, you eat a little, you eat a little. It damages you, it damages you, it damages you, and it damages you to such extents that at a certain point your body can't keep repairing that damage. The damage is happening faster than the body can repair it, and that's the point when you start feeling horrible. That's the point where you start really, really feeling reactive to it. So that's probably where you're at, Jenna, if indeed gluten is the issue. Now, you could also have developed a wheat allergy or something along those lines. There are some times where people, when they have a chronic antibiotic history, it disrupts the gut flora, and it can make you more susceptible and more allergic to more things. So, there are different aspects to what that could be. It's hard to say with just the information that you provided, but I would at least look at those two things. Marianne, hi Marianne, nice to see you on the show. When I went grain-free in 2012, my allergy-related asthma went away. I don't use an inhaler anymore. Lately, after a sinus infection in October, has left me coughing a lot and coughing up a lot of phlegm. And when I go home to 7,000 feet, I have a harder time breathing than where I live at 4,300 feet. I'm having to clear my throat an awful lot. I am considering asking my doctor to run some blood work. I have not had such a reaction from the sinus infection. There's a lot in that what's happening with you. If you picked up something in your lungs, one of the best things that you can do is you can diffuse some essential oil of thyme and oregano. You can also use a good one to use in this type. If you suspect kind of an upper respiratory or bronchitis, is tea tree oil. It's actually, there are a lot of research studies showing the effect of tea tree oil on different types of bacteria in a good positive manner. So that might be also helpful for you to try out. Let's see, Kayla, I lose tons of blood on my period. How do you calm down from stress? Well, everybody handles stress a little bit differently. And I think it's not so much how do you calm down from stress, it's how do you recognize where your stress is coming from and how do you mitigate it? How do you mitigate the stress that you can control? Because there's always going to be the things that we can control, and there's always going to be the things that we can't. So I think the best way to calm down from stress is to identify the stress points in our life that we could stop before they even happened. And for most people out here listening, that's going to be usually human stress, like human induced stress. So like maybe a relationship, maybe somebody in your life that is creating a lot of stress for you. And so in those types of scenarios, you have to make a decision about hanging out with certain kinds of people, or you have to make a decision about, again, where that stress is coming from, evaluate it. And if it can be removed, remove it. Because stress is one of those things, the more of it you have, the less you become capable of tolerating it as time goes on. So stress, it's like the proverbial straw that breaks the camel's back. A little stress, a little more, a little more, a little more, and then break, boom, we have symptoms. So it's identifying the sources and those origins of where the stress is coming from. There's three predominant forms of stress. There's biochemical stress, which is food, air, water. There is physical stress, which is, aggressive exercise or lack thereof. And then there is spiritual or emotional stress, which is relationships and spirituality. And so again, that look in those three areas of your life and really ascertain where that stress is coming from, and then, go backwards and reverse engineer which of those stresses you could actually remove today. And you'll be amazed at how that helps you cope with all the other stresses that you can't control. Another one, Denise is just chiming in here. Yes, gluten affects breathing. I used to have chronic sinus colds and couldn't breathe through my nose and would get a lot of mucus in my throat and would even get swollen in the throat. Yeah, absolutely. See, that's super common. Victoria, once a person removes gluten from their diet, how long should it take for the negative physical side effects to be resolved? I have been completely grain, dairy, sugar free for 22 days. The brain fog is gone, but I'm still very congested and plugged up in sinuses, ears. Will relief come soon? I don't know, Victoria. That's a good question. When diet, usually, the reason no grain, no pain is 30 days is because you got to give it at least that. So you're at 22 days. And I don't know if you're following all the rules of the no grain, no pain protocol, or if you're just grain, dairy, and sugar free. There may be some additional foods that you might benefit from removing because certain foods are mucogenic. So get your copy of no grain, no pain and really follow that protocol for a full 30 days. Now, there are some strategies beyond that can contribute to a person's persistent symptoms. And so one of the really common things that can happen in the sinuses with congestion in the ears is an upper respiratory infection. You might have, a sinus infection, you might have an ear infection, and they don't always have to be bacterial. I see in some cases where people have, yeast overgrowth in the sinus cavities or even in the ear canal. So, you might ask your doctor to kind of rule those things out for you as well. Let's see here. And the time just flies. We got all these questions and we just can't get them all answered in an evening. Okay, since several of you are asking this question, I'm going to answer it and then we'll wrap it up. So one of the things that happens, your diet is super clean. You're not eating grain, you're not eating sugar, you're not eating dairy, you're avoiding foods you're allergic to, and you're still struggling. You're still asthmatic, still having a problem. In those cases, again, this is my experience working with clients, is this. Those cases, a lot of times mold can be one of the missing links, and mold in the home, mold in the workplace, mold in the car, not mold, and even in some cases mold inside the person. So yeast overgrowth in the lung, yeast overgrowth in the GI tract or in the sinus cavity, but as well mold growing in the home. So yeast and mold are the same thing. It's just we just use those two different terms. But this is oftentimes a missing link that doesn't get investigated appropriately and doesn't get looked at. A lot of doctors won't look for it, and so it will never get found. So if you're still struggling, if this is you and you've done all this diet change and you've done all this lifestyle change and you feel like you should have better improvement, but you're just still struggling with airway disease, you might want to consider mold spores, and mycotoxins as a potential part of the problem, and ask your doctor if he'll help you investigate those areas, because those are oftentimes, again, where the missing link can be if the diet is super clean. Okay, well, I'm sorry I couldn't get to all the questions tonight, but, let's keep in mind, bring those questions back to me next week on Monday, 6 p.m. Central Standard Time for another episode of the Pick Dr. Osborne's Brain Show. And because I want to make sure I get your questions answered during these events. We have a certain amount of time we can chat. So if you'll do me a favor, those of you who found this information helpful or useful, please hit that share button down below. Hit that share button. And if you know somebody who's struggling with airway disease, with asthma, with inflammatory lung problems or chronic obstructive pulmonary diseases, share this information with them. You might just be the thing. You might just be the person that injects a powerful set of knowledge into their hands and helps change their life and save their life. Remember, together we can help change more lives and save more people. And that's what it's all about. So if you really got information that was valuable out of this, make sure you're sharing it with friends and family